NCLEX RN Exam 2026 questions to test your knowledge and boost your chances of passing. Question 1. The doctor is assessing a client with suspected meningitis for meningeal irritation. A positive Kernig's sign is charted if the nurse notes: Option A, pain on flexion of the hip and knee. Option B, neutral rigidity on flexion of the neck. Option C, pain when the head is turned to the left side. Option D, dizziness when changing positions. The correct answer is option A, pain on flexion of the hip and knee. Kernig's sign is positive when the client feels pain or resistance when the leg is extended while the hip is flexed 90 degrees. Question 2. A client with Alzheimer's disease uses her toothbrush to brush her hair. The nurse identifies this behavior as: Option A, pagnosia. Option B, apraxia. Option C, anomia. Option D, aphasia. The correct answer is option A, agnosia. Agnosia is the failure to recognize or identify objects despite intact sensory function. Using a toothbrush as a hairbrush signifies the client does not recognize the object's purpose. Question 3. A client with dementia experiences increased confusion late in the afternoon and before bedtime. This is known as: Option A, a chronic fatigue syndrome. Option B, normal aging. Option C, sundowning. Option D, delusions. The correct answer is option C, sundowning. Sundowning refers to a state of confusion occurring in the late afternoon and spanning into the night, common in patients with dementia. Question 4. A confused client says, "I haven't had breakfast, despite eating 30 minutes ago." Which response is best? Option A, you know you had breakfast 30 minutes ago. Option B, I am so sorry that they didn't get you breakfast. Option C, I'll get you some juice and toast. Would you like something else? Option D, you will have to wait a while, lunch will be here soon. The correct answer is option C, I'll get you some juice and toast. Would you like something else? In dementia care, validation and distraction are better than arguing. Providing a small snack satisfies the immediate request without causing conflict. Question 5. Which side effect is most often associated with the Alzheimer's drug Exelon, rivastigmine? Option A, urinary incontinence. Option B, a headaches. Option C, a confusion. Option D, nausea. The correct answer is option D, nausea. Exelon is a cholinesterase inhibitor. Gastrointestinal side effects, especially nausea and vomiting, are very common. Question 6. A client in active labor has a papular lesion on the perineum. Which initial action is most appropriate? Option A, document the finding. Option B, report the finding to the doctor. Option C, prepare the client for a C-section. Option D, continue primary care as prescribed. The correct answer is option B, report the finding to the doctor. Papular or vesicular lesions suggest an active herpes infection. This must be reported immediately as it usually necessitates a C-section to protect the infant from neonatal herpes. Question 7. A client with a diagnosis of HPV is at an increased risk for which of the following? Option A, Hodgkin's lymphoma. Option B, cervical cancer. Option C, multiple myeloma. Option D, ovarian cancer. The correct answer is option B, cervical cancer. Human papillomavirus, HPV, is a primary risk factor for the development of cervical dysplasia and cervical cancer. Question 8. A client reports a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is: Option A, syphilis. Option B, herpes. Option C, gonorrhea. Option D, condylomata. The correct answer is option B, herpes. Painful, fluid-filled blisters, vesicles, on the genitalia are the hallmark sign of a herpes simplex virus, HSV, infection. Syphilis, chancres, is typically painless. Question 9. A client is suspected of having NCLEX. The best confirmatory diagnostic test for treponema pallidum, syphilis, is: Option A, a venereal disease research lab, VDRL. Option B, rapid plasma reagent, RPR. Option C, fluorescent treponemal antibody, FTA. Option D, Thayer-Martin culture, TMC. The correct answer is option C, fluorescent treponemal antibody, FTA. VDRL and RPR are screening tests. The FTA ABS, fluorescent treponemal antibody absorption, test is the definitive confirmatory test for syphilis.